Recommendations for the first night after implantation. In order to avoid swelling on the forehead, put some ice on your forehead and temple. If you have sinusitis, do not do that. Put 2 pillows under your head while sleeping at an angle of 30 degrees. Sleep on your back. If you cannot sleep on this way, lie down on your sides. Moreover, if you had hair implantation at the back or top of your head, try to sleep on the right or left side of your body. Having good sleep is important for continuing implantation process the next day. Bear in mind that the bandage should not be opened or damaged at all. The implantation area should be rinsed with serum once the night before going to bed and once before going to clinic. If prescribed by your doctor, take cephalexin capsules every 6 hours and take vitamin the next morning during breakfast. Try to eat nutritious food and liquid, especially fresh or canned pineapple and orange, which contain vitamin C. Before going to the clinic, have a healthy breakfast. Wash your body and prevent washing your implantation area.
How to open the bandage a day after the implantation. First, soak the bandage thoroughly by serum, then take off the net cap and gently cut between the picking and the implantation area along the ear using a pair of scissors. Remove the bandage while the other hand is placed on the implantation area. During the process, pay extra attention to the implantation area. Wash the area again by serum and wait until it is fully soaked. Then gently remove the bandage from the implantation area. Washing the implantation area. During the first and second day after the bandage is removed, spray an adequate amount of salty serum on the head every 2 hours or gently pour about 80 to 100 cc's of the serum from the top of the implantation area, like a stream. Make sure to keep your hands off the area during the process. There is no need to repeat the process while sleeping. After the bandage is removed, it is possible to put some shampoo leather on a sponge and cleanse the implantation area by gently hitting the sponge on the head in a vertical position. The sponge must be gently pressed on the head. To continue the process directly, pour some baby shampoo on the head and let it soak the area for about 10 minutes. Make sure the movements are all vertical. Avoid any circular movement and massaging. Use a pint for rinsing and avoid using shower. Repeat the process at least twice a day for 2 weeks until residues are fully removed. During the 2-week period, it would be better to rinse the implantation area with water 3 to 4 times a day. From day 14, you can wash your hair regularly by rubbing your hand on your head, but only on one direction. Gently rub your fingertips on the scalp in one direction and let the residues come off until your scalp is fully cleaned. Remaining residues can cause infection, however, you must under no circumstance scrub them off with your fingernails. After 2 weeks, the scalp must be fully cleaned without any residue. Washing the picking area. On the first day after the picking process, wash the picking area with warm water and povidone iodine liquid and shampoo, then rinse with warm water. Apply some tetracycline ointment on the area. Use a light bandage to avoid the ointment from being rubbed off the head. On the second day, take off the bandage and repeat the same washing process, but this time there is no need to put the bandage back on. From the third day, you can wash the back of the head anytime you take a bath. You can stop using the povidone iodine liquid just 5 days after the implantation. Make sure that the liquid does not reach the implantation area. Application of medicines. Medicines must be taken exactly as prescribed by the doctor. Directions are as follows. Cephalexin antibiotic every 6 hours until fully finished. 1 mg finasteride, 1 tablet every night until fully finished. Vitamin supplement, 1 tablet each morning until fully finished. 20 days after the implantation, use 2% minoxidil suspension twice a day. Use 20 drops on the implantation area and press with your fingertips until absorbed by the scalp. Start using 5% suspension of the same medicine until the last drop right after the 2% suspension is finished. It is forbidden to use more than 20 drops or 1 puff of the medicine in each dose. Side effects of hair implantation. Swelling around the eyes and the face are considered as natural side effects of head and facial surgeries. Just 24 hours after implantation, slight swelling may occur starting from the forehead to areas around the eyes. Swelling may even cause the patient's eyes to shut a day after surgery. But there should be no concern since the side effects will automatically fade away after a few days. Compressing the eyes, eyebrows, and the nose bridge with warm water as well as gently massaging the affected areas could help cure swellings. Refraining from positions such as bending over like in prayer's position or tying your shoelaces could also be helpful. Do not scratch your head until 10 days after surgery. Itching is natural in the picking and implantation areas. Anti-allergic medicines prescribed by your doctor could help you get rid of the problem. Infectious pimples may appear in the picking and implantation areas. This is caused by the skin's reaction to grafted follicles. Such pimples could be treated by more careful hygiene, continuous washing, and the application of antibiotics. Post-implantation recommendations. Smoking is forbidden for 3 weeks after surgery. In case of urgency, smoking cigarettes and hookahs must be minimized. Aspirin would be allowed 2 days after implantation, but only if prescribed by the doctor. Alcohol should not be taken for a week after surgery. Heavy exercises like swimming and professional sports like mountain climbing, football and diving are forbidden for 2 months. Avoid strengthening, perming and blow-drying the implanted hair. Applying hair dye would be allowed only 2 months after the surgery. Do not wash hair with extreme hot or cold water. Warm water is preferred. Steam bath could be useful 3 days after surgery. However, using wet sauna is forbidden for a week. Do not use towel to dry the hair for a month. Instead, you can leave the hair to dry by itself. You must only use prescribed shampoos for a month. After that, you can go on using your own favorite shampoo. After a month, circular massaging of the head would become possible. After that, you can comb your hair, but just in one direction. For a week up to a month, you may lose some implanted hair, which is quite natural. Most of the fallen hair will gradually grow, and red spots on the implanted areas will disappear. 4 to 6 months later, your implanted hair will start to grow, but the strings will look slightly thinner than your natural hair. By the end of the 6 months, more than 80 to 90% of the hair will have grown out of the scalp. Between 9 to 12 months, 90% of the implanted hair will reach maximum growth. In 2 years' time, the implanted hair will become denser and will gain its natural look. Naturally, we all lose between 50 to 100 strings of hair every day, which will grow back again.